Healthcare AI agents, core components, architectures, and real-world applications. Executive summary. The healthcare landscape has been profoundly transformed by the integration of AI agents, which streamline processes, enhance decision-making, improve patient care, and optimize operational efficiency. These AI agents, powered by diverse architectures and core components, cater to a broad array of healthcare applications, from clinical decision support to patient engagement, predictive analytics, and personalized care. The underlying success of these AI agents lies in the synergistic interaction of their core components: cognition, memory, world models, reward, emotion modeling, perception, and action systems, each contributing to their systemic intelligence. In this report, we explore the various types of healthcare AI agents, how their components integrate to form their architecture, and the potential applications driving healthcare innovation today. Core components of healthcare AI agents: cognition, memory, world models, reward, emotion modeling, perception, action systems. Healthcare AI agents rely on a set of core components that enable them to process information, make decisions, and act upon their conclusions. These components, much like the faculties of the human mind, work in unison to drive the agent's functionality. 1. Cognition. Acting as the brain of the agent, cognition is responsible for reasoning and decision-making. AI agents combine structured logic and unstructured inference, allowing them to tackle well-defined tasks and adapt to new, ambiguous situations. This flexible cognitive capacity enables healthcare AI agents to navigate complex decision-making processes in clinical settings. 2. Memory. Memory ensures continuity in patient care by enabling agents to remember past interactions, medical histories, and decisions. Memory systems can be short-term or long-term, ensuring that agents don't lose context, facilitating personalized care. 3. World models. World models help AI agents simulate and predict potential outcomes. These models enable foresight, allowing agents to anticipate patient responses to treatments and optimize healthcare decisions. 4. Reward systems. Reward systems are fundamental in guiding agent behavior. In healthcare, these systems help AI agents learn from feedback, reinforcing beneficial decisions and behaviors while adjusting strategies when necessary. 5. Emotion modeling. Though AI agents do not feel emotions in a human sense, emotion modeling helps them respond empathetically to human users. This component adjusts the agent's tone and responses, creating a more human-like interaction that is particularly important in patient-facing applications. 6. Perception. Perception is how AI agents interpret the world around them. Healthcare agents rely on advanced perception systems to process diverse data inputs, including text, images, and sensor data. These systems are crucial for tasks such as diagnostic imaging and patient monitoring. 7. Action systems. Action systems are the mechanisms through which AI agents execute decisions. These systems translate the agent's reasoning into real-world actions, such as initiating treatment plans, adjusting hospital environments, or automating administrative tasks. 2. Healthcare AI agents types. Explanation and integration of core components. 7 types of healthcare AI agents: React AI agents, self-learning AI agents, memory-enhanced AI agents, LLM-enhanced AI agents, tool-enhanced AI agents, self-reflecting AI agents, and environment-controlling AI agents. Each play a critical role in addressing different aspects of healthcare, from decision support and personalized care to optimizing physical spaces. Integrating core components such as cognition, memory, world models, reward systems, emotion modeling, perception, and action systems enables these agents to work autonomously and in tandem with healthcare professionals, ultimately enhancing clinical outcomes and patient satisfaction. 1. React AI agents plus RAG AI agents. React AI agents represent a sophisticated type of healthcare AI that focuses on complex, multi-step decision-making. These agents excel in handling high-stakes tasks, such as diagnosing diseases or formulating treatment plans, by breaking down intricate problems into smaller, manageable subtasks. Their cognitive framework allows for both structured reasoning, useful for well-defined tasks like diagnostic decision trees, and unstructured reasoning, which helps navigate ambiguity and complexity in clinical scenarios. This dual cognitive approach makes React agents incredibly versatile in both routine and unpredictable medical situations. For instance, they might assist in diagnosing a patient by following a series of well-established diagnostic protocols or use causal reasoning when faced with ambiguous symptoms that don't fit predefined criteria. React agents store and recall critical patient information over time, including medical histories, diagnoses, and treatment plans. This memory is especially important in chronic disease management, where ongoing, personalized care is required. For example, a React AI agent managing a patient's diabetes would use historical data to modify treatment plans based on how the patient has responded to previous therapies. When combined with retrieval augmented generation, RAG, React agents can access real-time medical knowledge to keep their decision-making aligned with the latest clinical guidelines and research. This ability ensures that the agent's suggestions are continually informed by up-to-date medical information, making them indispensable in dynamic healthcare environments. In terms of world modeling, React agents use predictive models that simulate potential future outcomes based on patient-specific data. This foresight is invaluable when healthcare professionals need to anticipate how a patient's condition may progress under different treatment options. The addition of RAG agents further enriches this by incorporating real-time, external knowledge, keeping these simulations grounded in the most current medical research and treatment protocols. Reward systems in React agents reinforce desirable outcomes, such as accurate diagnoses or effective treatments, by providing positive feedback, further fine-tuning the agent's reasoning abilities over time. This continuous feedback loop helps optimize their decision-making. Emotion modeling within React agents is crucial for patient engagement, especially in telemedicine settings, where patient emotions like anxiety or stress must be addressed with empathy. These agents can adjust their tone and style based on the patient's emotional state, fostering trust and improving the patient experience. Lastly, action systems in React AI agents help operationalize decisions, automating tasks like prescribing medications, ordering tests, or generating reports, which reduces the administrative burden on clinicians and enables them to focus more on patient care. 2. Self-learning AI agents. Self-learning AI agents are designed to continuously evolve their decision-making processes by learning from past interactions and new data. Their cognitive framework allows them to adapt to changing conditions, learning from both successes and mistakes. This ability makes them particularly valuable in fields like mental health, where patient conditions can fluctuate and treatment plans need to be personalized and adjusted over time. Self-learning agents rely on ongoing feedback loops to refine their models, gradually improving their ability to predict disease progression, recommend treatments, and personalize care plans. The memory systems in self-learning agents are dynamic, storing patient histories, treatment outcomes, and other relevant data to help the agent refine its predictive capabilities. For example, a self-learning agent helping manage chronic conditions like hypertension can track a patient's medication adherence and response, adjusting the treatment regimen over time based on how the patient's condition evolves. These agents also rely heavily on world models, which simulate the possible future progression of diseases. With each new data point, these models improve, offering more accurate predictions of how a patient might respond to various therapies, thus guiding healthcare providers in their decision-making. The reward system in self-learning AI agents reinforces behaviors that lead to successful outcomes, such as early detection of disease or the correct prescription of treatments. As the agent's performance improves, so does its ability to make more accurate recommendations. Emotion modeling is another crucial aspect of self-learning AI agents, especially in mental health care. These agents can detect emotional cues from patients and adjust their responses accordingly. For instance, if a patient expresses distress during a therapy session, the agent can modify its tone to provide reassurance or suggest helpful resources. By continually adapting to a patient's emotional and psychological needs, these agents can enhance therapeutic relationships and improve patient outcomes. Perception is equally important for self-learning agents, as they need to process both structured data, e.g., clinical notes, test results, and unstructured data, e.g., patient conversations, sensor data. By synthesizing these diverse inputs, they can create a more holistic view of the patient's condition, improving diagnosis and treatment strategies. Finally, self-learning agents integrate action systems that autonomously adjust care plans based on the patient's evolving health data. This adaptability ensures that interventions are timely and appropriate, promoting better long-term outcomes. 3. Memory-enhanced AI agents. Memory-enhanced AI agents play a vital role in providing continuous, personalized care. They excel in maintaining long-term records of patient interactions, medical histories, treatment regimens, and medication records, making them essential for managing chronic conditions and ensuring continuity of care. These agents integrate cognitive reasoning with detailed, context-aware memory systems. By recalling past interactions and treatment outcomes, they can make highly personalized decisions that take into account the patient's complete medical history. This feature is especially valuable in telemedicine, where continuity of care over long distances is crucial. The memory component in these agents acts as a dynamic, evolving record of patient data. For example, in managing a patient with Alzheimer's disease, the agent can recall past appointments, track cognitive decline, and suggest interventions based on the patient's history. This enables healthcare providers to offer care that is not only contextually aware but also consistent over time. By storing and recalling critical patient information, these agents ensure that all clinical decisions are made with full knowledge of the patient's past conditions and treatments. These agents also leverage world models to simulate the future progression of a patient's condition based on their medical history. For instance, a memory-enhanced agent working with a patient with heart disease might use past medical records and predictive models to simulate the potential risks of certain interventions, helping clinicians take preventive measures to avoid complications. Reward systems reinforce the agent's ability to focus on relevant historical data, ensuring that it retains the most critical information that influences treatment decisions. Emotion modeling within memory-enhanced agents ensures that interactions are empathetic, especially when patients require long-term, ongoing care. The agents adjust their communication style to provide emotional support, fostering a strong patient-provider relationship. Perception systems in memory-enhanced agents process both historical and real-time data, allowing them to provide recommendations that are tailored to the patient's current and evolving condition. Lastly, action systems help automate key tasks such as setting follow-up appointments or adjusting medication dosages based on new information, ensuring that the patient receives the best care possible at all times. 4. LLM-enhanced AI agents. LLM-enhanced AI agents harness the power of large language models, LLMs, to process and interpret both structured and unstructured data. These agents excel in managing language-based healthcare tasks, such as clinical documentation, patient education, and decision support. Their cognitive framework, powered by advanced natural language processing, NLP, enables them to comprehend and generate meaningful insights from medical texts, diagnostic codes, and patient communications. This ability allows LLM-enhanced agents to assist healthcare providers by automating tasks like transcribing and summarizing patient interactions, reducing the administrative burden on clinicians. The memory systems in LLM-enhanced agents store vast amounts of medical information, such as patient histories, clinical notes, and medical literature. By accessing this stored data, these agents can provide evidence-based insights that are both contextually relevant and up-to-date. For instance, an LLM-enhanced agent might generate treatment recommendations by synthesizing the latest clinical guidelines with a patient's historical data. World models in LLM-enhanced agents involve processing large-scale medical literature to simulate potential treatment outcomes. By referencing historical cases and scientific studies, the agent can suggest personalized therapies based on what has worked in similar patient populations. The reward system in LLM-enhanced agents optimizes their language processing abilities, ensuring that the agent generates responses that are clear, concise, and medically accurate. The agents are positively reinforced when they provide actionable, patient-centered responses, which gradually improves their performance over time. Emotion modeling is also a key feature in LLM-enhanced agents, as they can adjust their communication style to match the emotional tone of the patient. For example, if a patient is distressed, the agent can modify its responses to provide comfort and reassurance. Perception in these agents involves processing and synthesizing a variety of data types, including structured data like lab results and unstructured data like patient conversations. This allows LLM-enhanced agents to generate clinically relevant insights and provide valuable decision support. Action systems enable the agent to automate routine tasks, such as generating medical documentation, answering patient queries, or providing treatment suggestions, thus allowing healthcare providers to focus more on direct patient care. 5. Tool-enhanced AI agents. Tool-enhanced AI agents are designed to integrate with various external tools, databases, and APIs to manage complex, multi-domain healthcare tasks. These agents play a crucial role in streamlining healthcare operations by synthesizing data from diverse sources, such as patient records, real-time monitoring systems, wearable devices, and external research databases. Their cognitive reasoning combines structured and unstructured data to assist healthcare providers in decision-making. For instance, in a complex case involving multiple conditions, a tool-enhanced agent can pull data from a variety of sources to create a comprehensive, integrated care plan. The memory component in tool-enhanced agents enables them to track patient health data from diverse sources, including wearables, sensor data, and clinical records. By maintaining an up-to-date record of a patient's health, these agents can offer continuous, actionable insights. For example, a tool-enhanced agent might monitor a diabetic patient's blood sugar levels in real time and suggest immediate interventions if readings become abnormal. 6. Self-reflecting AI agents. Self-reflecting AI agents are distinguished by their ability to evaluate and improve their decision-making processes over time. This metacognitive ability allows them to learn from past mistakes and successes, continuously refining their reasoning and decision-making algorithms. They are designed to improve their clinical decision support over time, which makes them particularly valuable in settings where errors can have serious consequences, such as in critical care or emergency medicine. These agents use memory to track their decision-making patterns and outcomes, learning from previous interactions to avoid errors and improve future recommendations. The ability to analyze past performance and adjust behavior based on that analysis makes them a valuable tool in improving clinical outcomes and reducing medical errors. The world models in self-reflecting agents simulate patient outcomes based on both historical data and real-time feedback, allowing the agent to refine its predictions as it learns. Over time, these models become more accurate and tailored to individual patient needs, helping healthcare professionals make better-informed decisions. Reward systems in self-reflecting agents reinforce desirable behaviors by providing positive feedback when the agent makes correct decisions. This feedback loop encourages the agent to focus on strategies that improve patient outcomes. Emotion modeling, while secondary, can be used to ensure that the agent responds empathetically to patients, adjusting its tone and communication style based on the emotional cues it receives. Perception is critical for these agents as they gather and process both historical and real-time data. This comprehensive understanding of the patient's situation allows them to adjust their reasoning and treatment suggestions dynamically. Action systems help these agents implement decisions in real time, such as modifying a treatment plan or alerting clinicians to potential risks based on newly gathered data. By continuously refining their processes, self-reflecting agents can become highly reliable decision support tools over time. 7. Environment controlling AI agents. Environment controlling AI agents are focused on managing and optimizing the physical healthcare environment in real time. These agents are designed to enhance patient safety, comfort, and treatment efficacy by adjusting various environmental factors such as temperature, lighting, humidity, and patient positioning. They leverage advanced sensors and AI algorithms to monitor the healthcare setting and make adjustments based on real-time data, creating an optimal environment for patient care. These agents use cognitive processes to assess the real-time needs of the healthcare environment. For example, they might adjust the temperature and lighting in a patient's room to promote comfort or reduce stress. In surgical settings, memory systems help these agents track the preferred settings for specific patients or procedures. By remembering patient preferences or surgical requirements, they ensure the environment is tailored to the specific needs of each patient. World models in environment controlling agents simulate the impact of environmental changes on patient care. For example, adjusting room temperature or lighting might influence patient recovery times or reduce stress levels, especially in critical care units. Reward systems reinforce actions that improve patient safety and satisfaction, such as optimizing room conditions or ensuring that medical equipment is readily available. Emotion modeling may also play a role, especially in patient rooms where environmental changes can be used to soothe distressed patients. Perception systems gather data from various sensors and real-time monitoring systems, ensuring that the environment is continually adjusted based on patient and procedural needs. Finally, action systems automate these environmental adjustments, making real-time changes to ensure optimal conditions for both patients and healthcare providers.